Hi, I'm Dr. Anna Saylor with Every Chiropractic Center, and I just wanted to go over KST really quickly. I got this question this week. What is KST and what is the technique that we use at the practice? And I just kind of was like, oh, that's a good one to kind of talk to everybody about. I have been a chiropractor for 21 years, and traditionally you're taught in schools anywhere from 1 to 9 techniques. And then when you get into practice, you start kind of looking for things that work even better for you. And it was about 13 years ago, backstory, I guess. I had fallen down the stairs probably 18 plus years ago, hurt myself really bad. My back was in so much pain. I was in more pain than most of my patients. I would adjust with a smile on my face, and then I'd get in the back and I'd sit on ice and I'd cry because my back was just so bad from that fall, and nothing was helping. I was trying everything. I was, my friends that are chiropractors, I was getting adjusted by everyone, and my body actually stopped responding to traditional chiropractic. My best friend and I practiced together, and she could barely even touch me, and my body would just go into spasms. So I knew there was something else out there for me, but I just didn't know what. And when I was pregnant with my first daughter, who is now going to be 13 soon, I was as big as a house, adjusting a lot of people. And I threw my back out so bad that my maternity leave started the next day because I couldn't walk. I couldn't get out of bed. I was screaming in pain, and it was awful. So when I say I understand what my patients feel, I really do understand what you go through, especially if you have low back like I did. And it was my SI joint, it was my hip. It was just so bad. And then being pregnant, I was like, okay, how am I going to deliver a baby the way I want to deliver a baby, natural and hypnobirthing? And there's no way I can because my hip was just awful. And so I was on maternity leave for about 5 months because I just couldn't come back. I couldn't adjust. And I kept reading articles by Dr. Koren. Koren Specific Technique is the articles. He kept writing about this technique that seemed really weird, very different. I was like, I am a hands-on chiropractor. There's no way I can do this. But something kept drawing me to his articles. Something kept telling me to check him out. And I had just kind of back into practice after maternity leave, and KST was coming to Detroit. And I remember driving to work on a Friday just going, I need to go to the seminar. I need to figure out something else for me. And I went to the seminar, and if you've been in our practice, it's kind of weird. The people are touching heads, and you're using a tool, and it's like, okay, I don't know about this. And I listened to it through the weekend, and I got adjusted on Sunday, and I was like, okay. And the interesting thing with my adjustment on Sunday is he never adjusted my low back or my hip. And what he said to me is, your C3 is so counter-rotated. What happened when I went down the stairs, I tucked, to protect your head, and I went down like this, and I threw my neck out so bad. But the pain was in my hip, and everybody kept adjusting my hip, adjusting my hip, adjusting my hip, and the pain never went away. But they weren't adjusting my neck the right way. So I got adjusted on Sunday, and I woke up pain-free on Monday. Pain-free. After years, I was in so much pain, and I woke up pain-free on Monday. And I said, I don't care what it takes. I don't care what it needs to do to learn this technique. I'm going to be the best at it. I'm going to do what I need to do to learn this technique and just do it. So I started studying, and I started learning, and I started doing more and more with KST. And it's very different. It's different than the traditional chiropractic. It's different than anything you've ever seen before. The question I got on the phone earlier this week was you're just, I don't know, is it Reiki? What are you doing? And it's a combination of a lot of different things. Dr. Koren actually, same thing with him. He had been getting adjusted and nothing was helping his shoulder. He had actually had an injury. And he went back to the old techniques based on Van Rump's technique, which is based out of 1920s. And he started just studying and using the best of all these different techniques to find out what worked best for us. And that's how KST was invented. And so now I've been doing KST for 13 years. It's amazing. It is very different. It's very unique. One of the things the woman said is, oh my God, you have so many reviews and they're all 5-star and everybody's talking about this wonderful technique. And it's true. different, but different is wonderful. So we don't do any cracking or popping. We use a handheld tool that adjusts under the pain threshold. We do a ton of cranial work. We actually are looking at the body differently. So if you have any questions about KST and how it can help you, please reach out to us. We would love to explain it. We always tell our patients, you don't have to tell people what it is we do. That's our job. You just have to say it works and get them to our practice. Once again, I'm Dr. Anna Saylor with Van Every Family Chiropractic Center, and I hope you have an amazing day. Bye.